Since 1 year, I think there is a step forward with the guiding extension and with APT guiding extension because they create the only one guiding extension with side hole. And for us, it's very important, not only for CTO, but for complex PCI in general, because then you can get deeper with your guiding extension and there is no ischemia for the patient. The pressure is normal and we can work in a better way. And I think for us, this is really a step forward. And so also for the CTO procedure. But mostly I think for the complex PCI.
Regarding guide extension catheters, we are not only using them for the support for the delivery of the devices, but we have utilization in many other components of complex PCI, especially in CTO PCI. We had new guiding catheters which are with much bigger lumen, with hydrophilic body, which are more and more atraumatic for the vessels. We today is developing also side holes extension catheters, which are not only for the, in my opinion, for the complex PCI, but when we need support, we are not afraid of deep-seated guide extension catheters because of the flow of the coronaries will be preserved with side holes and the pressure will be preserved and the contrast will be much more dispersed, not only to give on the exit hole of the guide extension, but contrast is much more dispersed and the hydraulic trauma to the vessel is much less with the side holes. But most important, the preservation of the flow is there, and we can freely do some work. Utilization of the guide extension catheter is way beyond today than simple support and delivery of the devices.
We have commented right now that we don't know how we lived before without catheter extension. You know, we have a lot of them right now. Before we have only one or two. What we need is that it navigate and go as deep as we need. So probably we would need catheter extensions longer that navigate better, and that probably it could be nice to have some anchoring device to let us to anchor the catheter extension to improve the PCI. But the extension and the extension catheter is not used only for implant stent or advanced some material balloon, whatever. We use it for externalized wires. We use it for protect and wire when you are doing atherectomy, dual lumen catheter that at the same time are extension catheter. Could be nice too for advanced materials. Well, you can dream.
Extension catheters now they have become a must in the CTO procedures. They are essential for us because they have a lot of utilities, and we are each year learning new utilities with the extension catheters. I think there is a room for improvement. I would like that the extension catheter had a better navigability. I think that could be improved in the next few years. And regarding the new modifications of the extension catheters, I think the inclusion of side holes in the extension catheter is a good idea because it's a safety issue, and I think that would make the CTO procedures more safe.